Go ahead, introduce yourself and your question.
Sure. I obviously didn't know the rule about the...
Now stay exactly on that X. If you move at all,
I'm not coming up there.
you will
don't
be
worry.
physically removed from the room if you get off that X again. So.
My name's Liz Dietrich. I have a company that's a research and marketing company based out of out of Burnsville, and it's called Dietrich RPM. The reason I just said Brainerd a second ago is I also am a co-owner in a business called Destiny Cruises out of Brainerd. And my question for you is regarding health care. My premiums for my research and marketing company went up 42%. And as a small business owner, I'm just wondering how you're going to help us reduce our health care costs so we can continue to compete and bring in new hires and offer the same health benefits.
Mr. Speaker, I'll start with you. I know this has been a concern of Republicans who have not been big fans of MNsure, to say the least. What plans, if any, will be unveiled maybe as early as tomorrow? Anything?
There's a good chance of that. You know, we have been concerned about it, and I think all Minnesotans are concerned about it. I think we saw that in the last election. What we need to do, first of all, is really own up to the fact that there is a problem. MNsure, and you know, we've got a Department of Commerce whose main job is really to protect Minnesota consumers. For them to come out and say that you know, from this year, from last year now to this year, we were going to have a 4 or 4.5% increase in rates, when later we found out that the real increase was something more similar to what she was talking about, like 41% on average. That's outrageous. And really we need to admit that, yes, this thing isn't working as well as it was supposed to. Republicans certainly want to make sure that Minnesotans have the best and the best opportunity and the best access to affordable health coverage in the country. And you know, we were leading the country before, and I think we can lead the country again and be innovative in that. But we have to make sure that we understand there are some problems with this. We got to put some transparency into it. We've got to put the right people in charge that have really experience dealing with these areas, and that's the way. I mean, we also need some competition, more competition, and we need to eliminate some of the government bureaucracy in it. The main thing that we've added with MNsure in the state of Minnesota is a new level of government bureaucracy, and that's the added expense. That's what we're paying for.
Will you try to scrap MNsure, or is that unrealistic?
You know, ultimately it's up to the federal government. They've said that we have to have an exchange in Minnesota. Would I love to? Absolutely. Do I think that we could do better here in Minnesota? Absolutely. Can we fix what's there now? I'm not sure we can completely fix it, but I think we can improve it. And we're willing to consider any and all options to make sure that we're giving Minnesotans the most affordable access and frankly, the choice that they deserve to have in their health coverage as well.
Will you introduce a bill to that effect tomorrow, getting rid of MNsure?
Not getting rid of it, but reforming it, yes.
Reforming it. Does it just need reform? Many government programs are not perfect right from the get-go, and they need tweaking. Social Security is a good example. What would you do?
Well, I think, first of all, I would say that, contrary to what Speaker Dowd just said, we still are leading the country in health care in many, many, many ways. And we need to acknowledge that fact. But the big issue here, it's not, I mean, MNsure was not health care reform. The Federal Affordable Care Act was not health care reform, it was insurance reform. And what we really need to do is actually do the kind of work that we started under in partnership with Governor Plenty a few years ago, which was actually health care reform and bringing down the costs of health care. And the reason we don't do that is because people don't like that. You know, it's bringing down the cost of health care is going to hurt doctors. It's going to reduce some choice for patients, and it's going to make people make decisions about their health care choices that I don't think everybody's going to want to make. But that is actually you know, as the governor said earlier tonight, when you're on the campaign trail, it's about rhetoric. When you're governing, it has to be about reality. And so that's the reality we need to face up in Minnesota, that it's actually health care reform and bringing down the cost of health care and not insurance reform that's going to get after this issue. I will say that, you know, notwithstanding all the bad stuff that's come out about MNsure, we do have still today among the lowest rates in the country. There were increases that people had to suffer, but the reason some of those increases went into place is because we're actually providing better health care, or actually real health care coverage to people, which they didn't have before. And we've covered hundreds of thousands of more people in Minnesota who have actually access to health care, which in the long run, because of the lack of uncompensated care and everything else, is actually going to save us money in our healthcare system. So it's not the disaster, MNsure is not the disaster that everybody is claiming that it is. And the reforms that they're talking about, I imagine, is going to be, what he's talking about is actually adding insurance company executives to the board. That, maybe that will make a huge difference in how our healthcare costs go. I doubt it. But, I think what we're talking about in transparency is that. So MNsure is here to stay. We need to keep trying to fix it, but what we really need is true healthcare reform.
Senator Bach, small businesses are really feeling the effects of rising healthcare costs. Anything the legislature can do to maybe target small businesses for some relief?
Well, I think the challenge is really a national one. It's not just Minnesota. It's that, with just about everything that we buy as Americans, we go shop for it. And we try to find the best value for it, except for health care. Except for health care. And we demonize the insurance companies who, frankly, all they do is pay bills. They get a bill from the hospital, a bill from the clinic, a bill from the dentist, and they pay them. Insurance companies aren't the problem. The public is going to have to accept the fact, and they don't like it, about how they become better consumers and they shop for it. And maybe the notion of higher deductibles and higher co-pays when people have additional skin in the game is going to help them think before they go to the emergency room instead of the clinic or instead of the urgent care. But until people who are the utilizers of the system become stronger, more knowledgeable consumers, we're not going to get our arms around the costs of healthcare delivery. And I don't know what it's going to take to get there, but it's going to start with everybody in this room when you think about the delivery of healthcare. And certainly prescription drugs, as we develop more and more and more of them, are a bigger and bigger share of the healthcare dollar. So that's a tough pill. The public's not there. Just like the governor said, people want better transportation, but they don't want to pay for it. People want better health care too, but they don't want to pay for that either. So we've got a disconnect there that as a state and a country, all of us as consumers have to figure out how to get our arms around how we do a better job of shopping for it.
All right, Senator Hand, final word on this issue. If you could keep it brief, that'd be great. We got a few questions yet to get
Sure.
through.
I think the key to this is health savings account, defined contribution plans. We need to give flexibility to employers in particular, but to all Minnesotans. And I think the unfortunate part about this is we've turned over a lot of the decision-making on health care to the federal government. We are under that umbrella. I think Speaker Dowd is right. We have to look for some relief at the federal level, but we have to be prepared here to be ready to innovate when that time comes. I don't think the MNsure structure is going to survive. It is not getting enough people enrolled to pay the bills. We have to recognize the reality of that and be prepared for something else. But I think fundamentally, making sure we can, at some point, give the employers the option to have health savings accounts for their employees and defined contribution plans, that'll be a big difference.